Majority of our country's population still live in rural and semi-urban areas. Unfortunately, in these areas, access to specialist healthcare, especially super specialties like gastroenterology, is either extremely limited or almost non-existent. What makes this challenge is people from rural areas hesitate to travel to the cities for treatment. Reasons are simple and real. High cost, loss of daily wages, traveling difficulties, and lack of awareness about digestive and liver diseases. As a result, what we see as specialists, it's deeply concerning. Many digestive diseases are diagnosed very late, sometimes only when complications have already developed. Conditions like fatty liver disease going on to develop cirrhosis, chronic ulcers, variety of gastrointestinal cancers, TB, inflammatory bowel disease could all have been detected early, treated effectively, and prevented from progressing. This delay has a direct and lasting impact on their overall health, productivity, their quality of life. To change this reality, we at Bangalore Gastro Centre Hospitals made a conscious decision. If these patients cannot come from the rural areas to see us in the city, let us go to the patient. We are taking super specialist gastroenterology services directly to the doorsteps of villages across Karnataka. We launched free rural outreach program for digestive health, first of its kind in the state of Karnataka, where we provide specialist gastroenterology consultations, various blood tests, liver disease screening, nutrition counseling, and preventive health education in digestive health, endoscopy services to detect ulcers, gastrointestinal cancers, inflammatory bowel disease, and various other gut issues. Essential medications are also given free. Most importantly, all of these are provided completely free of cost. Our focus is not just treatment, but detecting the disease early, prevention, and raising awareness, because various digestive health problems are largely preventable if we can identify the problem early. This initiative is about equity in healthcare. People living in rural areas of Karnataka, they deserve the same quality of digestive care as those in the cities. So the sustained outreach, patient education, community engagement, we aim to reduce the suffering from gut disease, prevent complications, and truly make a difference. This is not a charity work. This is our responsibility as gastroenterologists. Welcome to Bangalore Gastro Centre's mobile unit. This is the gastroenterology that is integrated into a bus. So you can see this, it almost looks like a hospital. So this is area where patient can have some blood tests. So this is a phlebotomy chair for patient sink. So we have got some patient education information. So we have got our endoscopy staff here, Prashikala sister, and Sindhu, who's our coordinator. So they are all very integral to the functioning of gastroenterology. So this is a scope cabinet. We can see different type of endoscopes that we use in these outreach camps. So we have got other equipments like hydrogen breath test, where we can diagnose somebody having bacterial overgrowth in the small intestine by just taking some simple sugar solution. And there is a urea breath test for detecting this bacteria in the stomach called H. pylori, which is such a common infection in our country, which causes variety of problems, including gastric ulcers, duodenal ulcers, gastritis, and even gastric cancer. So simple tests can be done just within a few minutes. So, and all this is all integrated in this unit. So we have got all this scope cleaning area, where essentially like a hospital, we are maintaining disinfection so that endoscope, once it is used, it is properly cleaned. So all the designated areas for putting the waste disposal, so that when we go to these villages, to the taluk headquarters, we don't just dump these in wherever. We will bring it back to our hospital and safely dispose the waste. So that is very, very important. So this is one of the clinical areas, and as we move in, so we have got an integrated very big sized fridge here. This is the samples what we collect for the blood test. This can be kept within the unit for several hours and can be safely transported back to the hospital, where we can analyze the blood reports at a later stage. So it can store the samples for several hours, which will give us adequate time to bring the blood samples back to our main hospital and process it accordingly. So this is a consultation room where we can examine patients. It's like a hospital bed, as you can see. So here we can consult the patient, examine them, and sometimes they just need some medicines or simple tests to be done. Not everybody in gastroenterology diseases they require any kind of procedures, so it might be sometimes simple counseling, simple medicines that they might all require. So we have got obviously this is almost like a examination room inside the hospital. So we got staff Naresh and Suchismita. They're all our gastroenterology team. So everywhere we go, we are taking a large number of very highly skilled staff, because it's not just the doctors, that there is a large team, which is almost about 50 people that go with this bus to deliver these outreach digestive health programs. We will be moving into this endoscopy unit, which is a very integral part of gastroenterology. This is where we do various procedures. So the procedures can be to check the stomach. It could be to, so this is like an endoscopy room inside the hospital. So you can see here where there is a hospital type bed where the patient can lie down, and this is a monitor where you can see the hand. So essentially very high definition endoscopes, even minor things inside the stomach and the food pipe we are able to make out easily. And endoscope doesn't only look at what the problem is. Sometimes we find small growths, early cancers, which we can safely cut and remove. So there at the bottom there is a machine which we can connect to the patient, and if they, sometimes we can do cauterization to burn off any internal bleeding vessels. We can treat ulcers, we can treat early cancers. This can all be done within this unit and very, very safely. So this is a very highly sophisticated unit that has been integrated into this large bus. This is the third in India, first in Karnataka.
ತೋರ್ಸಕ್ಕೆ ಬಂದಾಗ ನಾವು ಇವ್ರಿಗೆ ಚೆನ್ನಾಗಿರಲ್ಲ, ನಮಗೆ ಆರೋಗ್ಯ ಚೆನ್ನಾಗಿರಲ್ಲ, ತೋರಕ್ಕೆ ಬಂದ ಕ್ಲೀನಾಗಿ ನೋಡಿದ್ರು, ನೋಡಿ ಎಲ್ಲನೂ ವಿಚಾರಿಸಿ ಎಲ್ಲನೂ ಹೆಂಗೆ ಏನು ಅಂತ ಕೇಳಿದ್ರು. ಎಲ್ಲನೂ ಈ ಥರ ಅಂತ ಹೇಳ್ದವು. ನಾವು ಪಕ್ಕ ಎಲ್ಲನೂ ಬರ್ಕೊಟ್ಟವ್ರೆ, ಒಳ್ಳೇದಾಯ್ತು. ಇನ್ನೂ ಆಗಲಿಲ್ಲ, ನಮ್ಗೆ ಈಗ ನೋಡ್ಕೊಡೋಕ್ಕೆ ಸಾಕು, ಅಷ್ಟು ತೋರ್ಕೊಟ್ಟಾರೆ ಸಂತೋಷ ಪಡಬೇಕು.
ಏನಿಲ್ಲ ಸರ್, ಇಲ್ಲಿ ಬಂದಿದ್ದು ಭಾರಿ ಅನುಕೂಲ ಆಯಿತು ನಮಗೆ. ಮಾತ್ರೆ ಟಾನಿಕ್ ಅವೆಲ್ಲ ಫ್ರೀ ಹಾಕ್ಕೊಟ್ರು, ಫ್ರೀ ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡಿದ್ರು. ನಮಗೆ ಗ್ಯಾಸ್ಟ್ರಿಕ್ ಇತ್ತು ಸರ್.
ಎಂಡೋಸ್ಕೋಪ್ ಮಾಡಿಸ್ಬೇಕಾದ್ರೆ ನಾವು ಬೆಂಗಳೂರಿಗೆ ಹೋಗಬೇಕು. ಹಾಗಾಗಿ ಅದನ್ನ ಇಲ್ಲಿ ಕ್ಯಾಂಪ್ ಹಾಕಿರೋದ್ರಿಂದ ತುಂಬಾ ಜನಗಳಿಗೆ ತುಂಬಾ ಉಪಯೋಗ ಆಯಿತು. ಈಗ ಅದು ಎಂಡೋಸ್ಕೋಪ್ ಮಾಡೋದ್ರಿಂದ ಅವರಲ್ಲಿ ಏನ್ರಿಂದ ಗ್ಯಾಸ್ಟ್ರಿಕ್ ಯಾವ ರೀತಿ ಜಾಸ್ತಿ ಆಗಿದೆ, ಮತ್ತೆ ಅಲ್ಸರ್ ತರ ಏನಾರ ಇದೆಯಾ, ಪ್ರಾಬ್ಲಮ್ ಇದೆಯಾ ಅಂತೇಳಿ ಅವರು ತಿಳ್ಕೊಂಡು ಅದಕ್ಕೆ ಮೆಡಿಸಿನ್ ಕೊಡೋದಕ್ಕೂ ಕೂಡ ತುಂಬಾ ಉಪಯೋಗ ಆಯಿತು ಸರ್.